You and welcome to another edition of your favorite weekend program, Disability Inclusion, all the way from the network service of Radio Nigeria. Well, if it's your first time listening, Disability Inclusion Radio Program is a program that we talk about everything that has to do with persons with disabilities. We talk about the challenges they face, we talk about their struggles, we talk about, ways we can offer some form of opportunities and solutions to their problems. My name is Jennifer Ogo on the program, and on today's edition we are talking about improving access to medical rehabilitation for persons with physical disabilities in Nigeria. Medical rehabilitation. And we have two guests present, the chairman and vice chairman of the Nigerian Society of Physiotherapists, Dr. Nnamdi Eze, who is the chairman. Good evening and welcome to the program.
Good evening, thank you for having me.
And also the vice chairman, FCT chapter, Dr. Ayo Abioye. Good evening and thanks for joining us today.
Good evening, thanks for having me.
Physical therapists as rehabilitation experts have a unique role to play in fostering independence for people with disabilities and reducing human disability levels in Nigeria. Access to rehabilitation for people with disabilities is inadequate, with the attendant economic and social implications if the status quo is maintained. Changes are required in how people perceive disability and in legislation through policy direction and implementation to achieve the goal of equal opportunities for people with disabilities. The current dispensation indicates that physical therapists may have been complacent about the advocacy role that they need to play to bring about a positive change for persons with disabilities. Improve the advocacy for physical therapists and their organizations at all levels of the society will directly impact persons with disabilities and indirectly improve the professional standing of physical therapists. These are many more will be our focus today on the program. Once again, is Disability Inclusion on the Network Service of Radio Nigeria. My name is Jennifer Ogo, your host. Just to let you know that this program is audience participatory, and we'll definitely like to entertain opinions, suggestions, contributions from you as the program progresses. But starting off on today's edition, we have our guests, like I mentioned, from the Nigeria Society of Physiotherapy, Dr. Nnamdi FCT chairman, and Dr. Ayo Abioye. So let's get to hear from our guests. I'll start from the FCT chairman. Can you provide, an overview of the current state of access to medical rehabilitation for persons with physical disabilities in Nigeria?
Thank you very much, Jennifer. Just like I said, it's wonderful being on your program today. It's long overdue that we're supposed to be a part and parcel of programs like this, because just like you mentioned in your introductory speech, there's some level of complacency, maybe not the most appropriate way to go about it, but as much as we as professionals in the fields of rehabilitation and helping people with physical disability, we are doing our best in areas of creating some level of accessibility, and because going in the direction that should spell out the level of inclusion for people with disability, for them to be able to access some level of healthcare. You as a professional need some requisite training, because when you are not properly trained, there will be some level of less engagement, because these people with disability are people who, have a certain level of understanding of their problem. And looking at the medical model and the aspect of the medical side which we play a role in, it's important that the professionals are at the forefront of maybe the health promotion, trying to lay out some level of prevention strategies, and of course putting some level of putting a good amount of input in trying to reach out to these people in wherever locations they are, provide community-based rehabilitation by making treatments or interventions that may not easily be obtainable in the villages available for them. And because we need to look at them in that angle, because I was at the program sometime and there was this concept of institutional-based rehabilitation or community-based rehabilitation, talking about access again. And we found out that the model, which we all know, which is people with certain level of disability having to move from different directions or different distances. This time you have logistical challenges preventing them from accessing the right care. So in our society, we are at the forefront of the community-based rehabilitation, whereby we are not just waiting for them to come to meet us in the hospitals, but creating some level of training, you know, seeing the disabled people as part and parcel of their progress line. So we provide some level of training in the community, provide some level of training for the disabled people to identify certain levels of, to identify areas where they are having issues, and of course reach out to the medical provider. So what has this done? It has prevented the issue of people waiting so long, moving several distances into the institutional rehabilitation facilities before they can afford care.
Let's get to hear what your vice chairman has to say, Dr. Abioye. Just like briefly tell us what's the current situation of access to medical rehabilitation in Nigeria.
Thank you very much. The current situation to access of medical rehabilitation services in Nigeria, I would say, is not sufficient enough, because based on the World Health Organization report that 0.5% of people, in 10,000 people, only 0.5% of them have access to physical rehabilitation, especially in sub-Saharan Africa and Southeast Asia. So when we look at this space or this climb of ours, we discovered that there are only, according to the Medical Rehabilitation Therapists Board, there are less than 5,000 professionals in the Medical Therapist Rehabilitation Board, those that are registered with them, just less than 5,000. And reliably now, we have just above 2,000 that are currently practicing in the country. So even if the accessibility, the access and everything are on ground, the professionals now are not even sufficient enough to take care of.
Okay, we just want to get, you know, a broad spectrum of medical rehabilitation and basically the reach now to persons with disability or for persons with disabilities. So in a nutshell, a round table communique was held by TAF Africa that was a call for inclusive political participation. So we need to see persons with disabilities as head of parastatals, as, you know, give them ambassadorial positions. You know, we need to see them as cabinet members, and we need diverse representation of persons with disabilities in government appointed positions. Basically, that's what that news was all about. Well, thanks for staying tuned, and so much appreciation goes to Jemima Paul. Always a pleasure having you. It's Disability Inclusion on the Network Service of Radio Nigeria. And on today's edition, we are talking about access to medical rehabilitation for persons with physical disabilities. So if you're a person with a physical disability, this is an opportunity for you to ask your questions, to get, you know, better clarification about, you know, your condition, and basically just bring your suggestion, you know, to the topic of discussion for today. And we have two guests with us. They are from the Nigeria Society of Physiotherapy, Dr. Nnamdi Eze, the FCT chairman, and Dr. Ayo Abioye. So many thanks for joining us too, Dr. Nnamdi and Dr. Abioye. So now let's talk about some challenges that individuals with physical disabilities face in terms of seeking access to medical rehabilitation services in Nigeria. I know you've mentioned a few, like logistics. Dr. Abioye also hampered on, you know, on trained professionals. But do we have like any other major challenge that could pose a threat to access to medical rehabilitation for persons with physical disability?
Yeah, absolutely. It's a challenge for us, especially in the areas of even getting the requisite training for the medical rehabilitation professionals, because I had a discussion with somebody with physical disability one time, and this time it's I think there is this cerebral palsy issue. It's on the rise, and we found out that only about 5 physicians were trained. Possibly about 5 physicians were trained in physical rehabilitation.
Sorry to cut short.
Yes.
Do we have a specific number, or do we have a data about the number of trained physiotherapists in Nigeria?
Yeah, sure. Dr. Ayo mentioned the data we have from Medical Rehabilitation Therapists Board. We have about 2,000 physiotherapists.
In the whole Nigeria?
In the whole Nigeria, and of course, a lot of, as we can see the situation in the country, a lot of people are already outside Nigeria. And
okay, we have most of our physiotherapists now traveling outside.
Good, exactly. So I wanted to arrive at something, and my discussion with the disabled person, it was all about when he goes into the hospital, it just seems like nobody understands him. Are you getting me? So you can see that of the right professionals to handle them. See the lack of the professionals on ground to handle people with these problems. So that has put in a lot of space into it. So that's a big challenge on one hand. And of course, earlier I mentioned about the logistical challenge, whereby people who are disabled mainly live far from town, and accessing facilities that provide a rehabilitation service may also be an issue. Then you have the attitudinal problem. A lot of people with disability, attitude from the people with disability.
Okay.
Some of them see themselves as, I can only benefit from charity, So they've accepted that role. They've accepted that, God has done this into them, and it feels like nobody can help them. So I just better stay wherever I am, stay in my village, stay in my house, and not even bother about, going to the hospital or even seeking a medical rehabilitation professional. Most importantly, you could see that we don't have the necessary data for even the government to make adequate policies on how to help these people. I was going through a research, and I found out that close to about 1 billion people all over the world are suffering with some level of physical disability. And 80% of that data reflects people in the low and middle income countries, of course, which Nigeria falls into. But you only see people with disability on the streets. Of course, when you are driving by traffic, you see somebody, maybe someone who is deaf, someone who cannot move. That gives us a picture of what it looks like. But what we are saying is 80% of 1 billion people, that tells you that we have a lot of numbers. So the data to even make adequate policy for them is not available, because if that data has really reflected that number, that need, and the lack of the professionals, you see, the government should do more in trying to train more medical rehabilitation professionals, invest more in medical rehabilitation, encourage community-based rehabilitation, because just like I said, people with disability may find it more difficult coming into